Perhaps just a little bit of background first, being very much tied up with the Ministry of Health and changes that are occurring through the Minister of Health. There's been an update recently to the New Zealand Health Strategy. It was led by the Director General of Health and was released for public consumption on the 18th of April, just a week or so ago. One of the key elements of that is changes to the way in which the health system will operate over the next 10 years or so, including equity of access of services being a key outcome required. It's also true that nearly everything within the new strategy requires IT and information to support the changes that it recommends. And in that regard, the National Health IT Board has also been working with the Minister of Health and the Ministry of Health over the last year or so to develop a strategy for IT going from 2015 through to 2020. And that relates to the introduction of a few new components of the health strategy relating to an electronic health record for all New Zealanders. And when I say all New Zealanders, I mean all New Zealanders, wherever they may be located. That will supplement the work that we've done over the last few years on patient portals, and I hope you've all got access to your portal in conjunction with your local general practitioner. It also relates to the digitisation of all components of the health system, both in terms of hospitals, community and general practice in each of the four regions, Northern, Midland, Central and Southern. It also is a revamp of the preventative care functionality through screening, etc. And also, where appropriate, the sharing of information from the health sector through to the wider social sector environment. So quite a big change coming through in that area. And that's for all New Zealanders. The other thing that we're enabling through this process is much better access to the combination of the healthcare environment and personal health records. So you may well have your Fitbit on and you may well be recording information. At the moment that information is personal to you, but wouldn't it be good if you could actually also combine that with information from the health system? And that's the goal. So typically if you have a graph of your blood pressure, it will have green dots provided by yourself and blue dots provided by the health system or your general practitioner typically. Obviously, in terms of looking at this picture, we must make sure that the privacy of health information is maintained, and so we need to have a security framework, and that's being established through the National Health Index and the Health Practitioner Index and the authorisations associated with that, the audit trails and the break glass conditions, so that when you're in a coma on a hospital and after an accident, you still get good care, but the information is properly managed. For some years now, since in fact 2009, we've had a safe sharing of information via Connected Health, which is a network of networks through points of interconnect in Wellington, Auckland and Christchurch. And that enables retail service providers to provide health services to the sector, because remembering that it consists of a whole lot of components, hospitals, government through to private enterprise, they can all work together and they can all be interconnected. So now you've just got to make sure that everybody at the end points can be connected to these networks. The idea is to make sure that everybody in the environment is connected, not just a few parts, but going right down into the community, whanaora, pharmacies, you name it. It all needs to be connected. And once you've done that, then you can start to deliver some of the virtual health care within the community. There's functions already operating in terms of diagnostic treatments for skin and also for the provision of dialysis in the community. But a wider range of collaborative working facilities is available, and I think John Garrett is going to mention a little bit more about that later on this morning. Telehealth, more widely, you've seen a very good illustration of the sorts of things that can be done with robotics in healthcare in the home and also in community facilities. Obviously, that's going to become a major part. Again, it doesn't replace the general practitioner or the health practitioner interactions, but hopefully it reduces them and provides people with a lot more confidence that they're managing their health care, their well-being themselves. And of course, we need to be able to deliver that virtual healthcare facility anywhere, on the road, at accidents, through mobile surgical services. It doesn't matter where we are in New Zealand, we need to be able to deliver the same quality of care, the same capability of care to any person that needs help. So all of that builds off the current government ultra-fast broadband and rural broadband initiatives, and you've heard quite a lot about those. Some of the characteristics that we really want to have from a health point of view are predictable and reliable performance. So it's not just a matter of having those capabilities, we need to have the performance as well, so that we know that when we actually do something to support a patient, we know that it's always going to be repeatable, it's going to be consistent, and they're going to get a good experience. Actual wireless broadband coverage today, Russell said around 50%. That's true, it's around 50% of the land mass, about 97% of the population, but that still leaves an awful lot of holes in the coverage, and that's something that obviously the Rural Broadband Initiative 2 and the mobile black spots is starting to address. Some of the details of that, if you have a look at that graph, the picture there of the East Cape, I don't know whether you're able to see the red dots, but the red dots are people that are not well served today. Even though most of the area is well covered, the red dots are still people that don't get service. And so people do live everywhere throughout New Zealand, and we need to make sure that they can be connected and served with health services the same as urban people. Likewise, accidents occur everywhere. You might recognise these photographs from a very critical accident in the Otera Gorge over the Christmas period. Obviously, people had to travel quite some distance before they could actually even call on assistance from an ambulance, let alone getting the ambulance to the location, because it was in a black spot. So we've got to deal with the black spot issues. So we still have some work to do, and that involves work from both the broadband connectivity point of view in terms of serving the parts of New Zealand that are not served today, and also in terms of developing that capability that I mentioned at the beginning of the presentation around the longitudinal electronic health record for every New Zealander, so that we know that the right information is available at the right time when you need it. Thank you very much.